Well, this whole thing started around last week in March or first week in April. The INSACO called me up and asked if we can work something out at mechanical engineering on manufacturing ventilators.
And then off the ventilator group, we had subgroups on splitters versus what we call transfer ventilators. And then we had 3 groups working on 3 different concepts and still do working on that.
The first group was led by Dr. Joe Dannemiller, actually with his son Mark. The second group was led by Dr. Jeff Hansen at Mechanical Engineering Department with the senior design students.
I get pulled in mainly through instrumentation. They say, well, how are we going to measure flow? You have to figure out how much air you're delivering.
All designs are based on something called artificial manual breathing unit or AmbuBag.
An AmbuBag is operated by either the nurse or the doctor, and so they won't be able to operate it in emergency situations where they need to deal with a lot of patients at the same time, or if it's a transfer patient from one hospital to another.
Well, the reason we call it a transfer ventilator is because most of the time they'll put someone on it and then they'll ship it to the main hospitals at UMC to take over. So they only use it for 8 hours, 7 hours, 10 hours most of the time.
The pressure sensor, which is another sort of important parameter to keep track of, that was done by Barak Aksak and another student that he and I share, Robert Kovenberg.
So what we wanted to do is we wanted to convert an AmbuBag into a ventilator type device. And the idea was to replace the operator with a mechanical device so that the mechanical device can actually operate the AmbuBag. It's a system that is able to sense the pressures, sense the amount of air that is the tidal volume that is transferred to the patient. You can imagine lungs as a balloon, and you can burst the balloon. And so you want to make sure that you know what kind of pressure the air is or what kind of pressure you reached when you're pumping this air, right? So we want to be able to monitor the amount of pressure that we're delivering to the patient. It's very important.
We created a couple of these alpha units. We packaged them up so that we could take them around to some of our partners in healthcare, service, and got their input on, what do you think? Is this going to work? Would this be reasonable?
Genève is visiting and talking to local hospitals out in the rural communities.
I can easily relate to the clinicians' priorities and expectations from working on a project that requires commitment to a large extent. Also, having worked with engineers for a considerable amount of time now, one thing that stands out to me is that they're willing and capable of investing time and effort to solve a clinical problem. But oftentimes, they do not know the challenges the clinicians are facing in their daily practice. It is very critical to acknowledge this gap and invest intelligence and resources to seal it, as Whitaker College of Engineering did.
After, incorporating as much of that into the alpha units, we took those to a manufacturing partner. Ludlam Measurements is a privately held company in Sweetwater. We're looking at a potential production run of 150 units. The first design I'm going to show you is a rack and pinion, okay? So there's a frame that holds the bag, and the motor turns a gear, the pinion, and the pinion engages a linear gear, the rack, and drives it into the side of the bag, just like that, and releases like that, okay? You can see the sort of holder for the bag, and then the motor is here. There's a gearbox, and then this piece here is the rack, and the pinion is on the other side. It's attached directly to the transmission for the motor. There's another one called a paddle design. So there you can see the bag attached and a hose that goes off to the pressure sensor and the flow sensor, and it's also attached to the patient simulator. There are these 2 hands that come in and squeeze the bag. So here's a little Raspberry Pi that currently I'm using for development. In production, this will all be controlled by a touch screen that's on the outside of the case. If I run this, it's going to ask me several questions like, how many breaths per minute? and the default is 12. But now I'm going to say, run for 20 seconds. That's like 5 breaths. 20 seconds. And now, if everything's right, it's going to run. So there it is, working the bag.
This is not in no way, shape, or form is meant to replace a ventilator. This is for emergency use. This is when all options are out, they should be able to use this at least to gain them some time until the patient can be hooked up to a ventilator if necessary.
I mean, I can't have enough words to express it, but it feels great to try and work out something to help the community in these trying times.
We just want to make sure that we create something that people are going to use, and hopefully it's going to save lives.